All right, I'm going to start. Welcome back, everybody, to the ICFJ Global Health Crisis Reporting Forum. As you might remember me, I'm Stella Roque, Director of Community Engagement at ICFJ, based out in Washington, D.C. Today, it's my pleasure to introduce Paul Adepoju, who is joining us all the way from Ibadan, Nigeria. Paul is a prolific and award-winning freelance journalist and researcher and an academic and publishing author. He covers the science, health, tech, and development landscapes across Africa for leading local and international media outlets, including CNN, Devex, and Quartz. He's also drawing global attention to the science landscape in Africa for leading scientific publications, including Nature, the Lancet, and the British Medical Journal. He's also a media entrepreneur, the founder of healthnews.africa and healthnews.ng, in addition to leading the team at healthdata.africa. Today, he'll be providing a training on tips on finding local health stories, verifying claims made by health experts, and how to work with data when your government isn't publishing any. We'll be taking your questions at the end of the training. Please type any that you have during the webinar onto the Zoom chat or under the stream of Facebook Live in the forum group. Thank you so much for joining us, Paul. Over to you.
Hello, how you doing? Good afternoon, everybody. It's 4 p.m. here in Nigeria. I know it's morning in some parts of the world and it's evening elsewhere. But I'm really glad to be here. I'm a big fan of the projects that IJNet is conducting, especially its ICFJ program, including the forum. The Facebook page is highly engaging, and I'm really glad to be here to share my knowledge with colleagues. Thank you very much for having me.
Thank you, Paul. And are you ready to share your presentation with our audience?
Oh, yes, I'm ready.
Most excellent. I'll see you all later. I'm coming back at the end.
So good day, everyone, and thanks for joining me today. And the goal of this webinar is to look at two issues that may appear as if they are in isolation, but they are actually together. And by the way, my name is Paul Adepoju. In case you did not get the pronunciation, how Stella pronounced it, and I have pink eyes, so that's the reason why I have my sunshades on. It's not by default. It's not as if I'm trying to show off. It's just to ensure that I'm not scaring you away. Okay, so like I said, data and verification may look to exist in isolation, but in the truest sense of it, there is actually an overlap. Because if you have a data, if somebody is presenting a data to you, and you are not able to ask yourself, how do you handle this data? Is it the true information that you have with you? Then there will actually be a serious problem, and you may have to lead to, you may be misleading your audience. So I'm a freelance journalist, and even though I cover science and health predominantly, I still write on other issues because I generally regard journalism as an all-encompassing field that is not just peculiar to any space or not. And so when we look at, sorry, I'm trying to direct my slides. So when you look at, can somebody help me? I'm trying to move my slide. Yeah, thank you. So when we look at health journalism, from my experience in this space, I've come to realize that there is a lot of misconceptions about what health journalism is. And I wouldn't like to bore you with definitions because I know we know how to define these terminologies, but I started realizing that there is a problem when I was part of a training in Senegal and we were asked to start pitching health journalism stories that people would write. Then colleagues started talking about how pitching stories on the effect of diabetes, how is talking about specific diseases. Even though these are topical issues, I wouldn't regard them conventionally as a topical health journalism topic because of the fact that there is a whole lot of difference between when you are trying to report news and when you are trying to give people health tips. So I always describe health journalism as 100% journalism. It's all about, it checks all the boxes of journalism. We are trying to tell stories. We are trying to inform the public. We are trying to research and call attention to something that many people are not taking cognizance of, information that is dependent, that is required, and can actually bring about significant changes or have significant impact in the life of the people. So we are telling stories. So if you're in health journalism, is not really about giving health tips. It's about telling stories and telling the news that itself. And if there is any message that COVID-19 has actually presented to us, is the fact that health can actually be mainstream. When I started health journalism, I remember when I was in my final year during my undergraduate study. I am lucky. I would say I would just call it lucky. I'm lucky to have a medical background. And one of the reasons why I decided to venture into health journalism was the fact that anytime I opened newspapers in Nigeria, then my class, I was fond of buying newspapers back then. I would be reading stories of uh, health stories that will be published in the publication would be stories that they got from foreign news outlets like the New York Times. And I will be asking myself, is it as if we don't have relevant health issues that should be reported on in Nigeria, or we don't really know how to go about it? And when you look at health sections of newspapers too, they are really close to the front of the newspaper. They are usually somewhere towards the back of the pages. But since last year, when the world started, when COVID-19 became a global pandemic, consistently day in, day out, week in, week out, month on month, the topic COVID-19 has consistently been on the front pages of most of the major newspapers, which actually shows us that health journalism has the capability to drive the same attention like other aspects, like other genres like politics, entertainment, and the likes, if it is done properly well. And since the pandemic began, a lot of people have been covering COVID-19 in different cases. And this slide is showing you some of the stories that I've actually written personally myself, ranging from when the first case was reported in Nigeria, which is the Nigeria response to COVID-19. The Nigeria's first case was the first in sub-Saharan Africa. And I've continued to look at it, this pandemic from different angles, both from Africa-wide approach and from a national angle. So if you look at it, my coverage has also shown that COVID-19 is not just we can't just restrict it to just one narrow-handed perspective like an infectious disease. There are several other components of the pandemic that are really worth reporting on. For instance, there is a technology element. We also have the misinformation element, and we have its effects on other diseases such as tuberculosis, how it's actually affecting it. Then there's also the component of mental health, and of course, the research aspect. These are just some of the aspects that COVID-19 can also be looked at. And why is this important? I've come to realize that many journalists, irrespective of where you are, people see COVID-19 in a very narrow perspective. Some of what am I trying to say? When you want to write, when most of the stories that people write about COVID-19 are like, there are 10,000 new cases or 5,000 new deaths in America. There are this number of cases again. That is the most popular approach to reporting COVID. And this appears to me to be predictable. It also seems to be very, very boring. And when people are, look at, sometimes when I want to pitch a story, or when I'm thinking about how to write a particular story, I usually go from the perspective of the reader, is that, will a reader be interested in reading this? Is this exciting? Because every now and then, week in, week out, we are talking about 10,000 new cases, 100 new cases. This is also number of people have tested positive. It's always a familiar tone that the reporting has been characterized with, and it has been boring. And many health journalists that are attending this webinar would agree with me that, considering the duration of the pandemic, it might seem to have become very, very boring, or there is no new thing for many journalists to actually report on, because it seems as if we've seen it all after covering it inside out every day for a duration of 1 year. It may look as if there is no fresh angle to this pandemic. And this reason is that we are looking at it from a narrow-minded perspective. So I said COVID-19 doesn't have to be boring. For instance, look at these two major stories that I wrote for Devex. They have, even though they are still on COVID-19, they had nothing really per se. The bulk of the story weren't on the number of cases, but other aspects, non-medical issues that have significant impact on COVID-19. For instance, I examined how politics was getting in the way of Nigeria's COVID-19 response, how individual labs were holding their own results and were unwilling to share with the rest. And I also talked about the elections and COVID-19. So these actually brought fresh view, fresh mindset, fresh approach to the pandemic reportage. Then if you look at right down in the corner, one of the stories that I wrote for the Lancet microbe, I also looked at neglected tropical diseases in the time of COVID-19. And so what I'm trying to say is that we cannot exhaust the numerous issues, the numerous perspectives, the angles, and the lines of thought that are available for us to explore when it comes to COVID-19. And data has emerged as a very, very good way, personally for me, a, an amazing approach to getting new ideas to reporting it. But before you talk about leveraging data to to meet your needs, or to get you story ideas, there are some things that you have to know. I would say that you need to start reimagining the way you look at data. What am I trying to say? When you talk about data, I know people will say that the first thing that comes to your mind is that, how many percent of this, how many women, how many children, how many adults, how many pregnant women. That is the highs that many individuals see health data from. But this is way more than this. This is actually a tiny aspect of what health data does for us. Because health data tells a story. It tells a complete story, and it allows you to have everything in um, in a particular overview. You can have an overview of different aspects of a particular issue. And when we are able to do this, when you are able to reimagine data, then you understand, you start seeing the difference between how you are getting your story ideas from data and how you are actually leveraging data to uniquely tell your stories. Then you also have to understand that there are some things that what data can tell you and what data cannot tell you. For instance, now, data will not tell you who is to blame, but data can tell you what is wrong. Data cannot tell you which political party is not handling a particular crisis very well. But data can tell you how many number of people are dying over a particular period of time. Data cannot tell you if a particular country can afford the COVID-19 vaccine. But data can tell you the GDP, how the earnings of a particular country has increased over a period of time. So this may look as if they are very, very tiny, but they are very, very important for you to understand this so that when you are working with data, when you are approaching data, when you are analyzing data, you know how you are thinking, you know how you are putting your points together, you know how you know what you are looking for, and you know what you're expecting. Because it's only when you know what you're expecting that you'll not be disappointed. And it's only when you know what you are playing with, what you are working on, that you can actually maximize data and you can actually enhance your reporting. And it doesn't mean that these two cannot inhabit, you cannot get it in your story. It simply means that you have what data cannot tell you, you have to get it elsewhere. What am I trying to say? When we are saying that when you have a trend, for instance, now when COVID-19 cases are increasing, uh, COVID-19, if you are looking at the testing data for a particular country now, what you can get is that, okay, it can tell you that on December 31st, at the end of 2020, let's say 500 new cases of COVID-19 were confirmed on December 30. But today, as of today, the data can now tell you that we now have like 1,400 new cases that were confirmed. And you can now say that 1,400 new cases confirmed, that number of cases of COVID-19 has tripled. We now have three times higher cases. That is how some people are going to interpret it. But in itself, as a good journalist, your work as a journalist does not stop with you just reporting 1,400 cases, that the number of cases has tripled. The first thing you need to ask yourself, which data will not tell you why has there been increase in the number of cases? For instance, let me give you a case example. I stay in Ibadan here in southwest part of Nigeria, and there was a time during the few months into the pandemic, few months into the pandemic, we began to see cases of there will be focal cases in which 400 cases will be reported. Sorry, the numbers will be fluctuating. There will be days that the numbers will be so high and numbers will be so low. The urge to say that cases are rising in Nigeria, in the States, was there. But I had to realize that I eventually realized that it is because of the fact that they were pulling samples together. It was so they would do community testing, and when they go to the community to test more people, then they are going to get more cases. So that was a finding. That was something that I observed as a result, was responsible for that. So if I had been a lazy journalist and I just went ahead to publish that number of cases had already tripled, because I'm seeing the data that is showing that still cases are already tripled, then I would have misled my audience. I don't know if I'm communicating. So what you need to do is that whatever you are seeing in the data, before you go public as a journalist, you have to still attempt to get a form of explanation that will tell you that this is what is responsible for what I'm seeing. This is what is responsible for the findings in my data analysis. So you should know the limitation of the data. Data will not tell you they did not test yesterday. Data will not tell you the machine broke down yesterday. Data will not tell you they've exhausted. For instance, if the number of cases dropped and it was due to the fact that they've already exhausted their testing kits, data will not tell you that they no longer have testing kits. But you, as a journalist, you have to take that additional step. After understanding your data, you speak to your data. You talk to experts, those that are involved, so that they can be able to provide better insight into what you are doing. So what about buyers? I would like to establish that whatever you are looking for as far as the internet is concerned, there is a data that will support it. So whatever it is you are looking for online, so if you are not careful, you will always find a data that will support whatever you are finding. And this is the reason why you have to deal with bias. And what is, you may say that, oh, I'm a journalist, I'm independent, I'm not biased. But let me ask you one question. When you are saying that, when you are looking for, when you are trying to write a story, when you are trying to do a report, and you are finding a particular trend, you are expecting something. You're expecting to say that more people are dying already. You are expecting to say that more lives have been lost because of this. You've already given yourself something that you are looking for. When you are saying that as cases are increasing, more people are dying, there is already that bias. You already have a preconceived mind on what you are looking for. In some cases, some journalists would have already even written the story. They would have already written the story and would just be looking for data to support what they've written. This is a practice that many journalists in various parts of the world would agree to actually exist. And is unfortunate because where we are living in a very polarized world in which there are different schools of thought, there are different beliefs, conspiracy theories abound, and everybody is looking for everybody is using the internet, and there are data sets that would align with whatever ideologies any individual or group has. So as journalists, we should also ensure that in our quest to make use of data, we are also, in our quest to make use of data, we are also leveraging on the fact that we are eliminating bias. So whatever would bring about bias, whatever will bring about that will make us tend towards, move towards a particular angle and feed the fake news narrative that journalism is trying to get itself rid of, we should ensure that we are avoiding it. So how do you do this? How do you achieve this? The first thing that you should do is that always approach an issue with an open mind. When I want to analyze data, when I want to work with data, I always, even though I have a notion of what it could look like, I always ensure that I'm open-minded to whatever comes my way. And why is this important? Don't forget, data cannot talk or speak. They cannot walk, they cannot shout. But if you are open-minded, you are going to see unique trends on your own. You are going to see insights that may actually be different, entirely different from what you are looking for. And that is the beauty of it. I think we need to move from you using data to verify what you already have in mind. Instead, using data to give you the direction of how you explore your stories. So get the data, raw data, analyze it, and look at what the result would be. For instance, if you have a spreadsheet, if you are crunching data on the trends, plot a graph, input the data independently, let the graph be generated, look at the peak. You may be surprised that you would think maybe it was during Christmas that COVID-19 cases increased, but it was just maybe an entirely different period. And you wouldn't know that if you are only looking at the data from Christmas period or before. So there is data to support everything. And that is more reason why you need to get rid of bias in whatever you do. So get yourself, your thoughts, your opinions, your mindset out of the system and let data do whatever it wants to do. So, so we takes us to an important aspect, that where is this data? Where is this data? And the first thing, something I want to say is that data is everywhere. You can see data all around you. And COVID-19 has actually been a very, very unique case, because apart from just one or two countries that are intentionally suppressing their COVID-19 data access, almost every country in the world is allowing access to their data. And I want to quickly do a quick demonstration now. If you look at Google, if you just log on to Google on its own, uh, and you say Google, when you go to your Google search tab and you just type COVID-19, they've made it so that you can actually, the first thing that comes to your mind, that comes to your screen, is the data of your party, of your country. So when you type Google, you are actually able to see, and when you search for COVID-19 on Google, you are actually able to see, Google will tell you the latest figures in your country. And that is something that is very, very useful. Google's landscape, Google search results is extensive, and it allows you to actually have, in a snapshot, you are seeing the global data, you are seeing the national data, and you are seeing your country's data. So I'm trying to, so that is what Google tells you from, that is what Google tells you from its interface. So you're able to actually see everything, that every important data that you can see that you need. I'm trying to make a demonstration. Yes. If this is clear, this is Google interface. So let's say you just search for COVID-19. So yes, this is the search result. Now, when you scroll up, because my state is your state, from this angle, you can see the number of cases in my state, in the city that I am. You can see the number of cases in Nigeria, and you can even see the number of cases across the world, the number of deaths, the number of people that have recovered, and the number of, in each of these city, in each of these concepts. And another thing that I want you to do, on Google, I just search for, as you can see what I did, I just search for COVID-19. This is real time. This is not a static demonstration. So what you can also see, if you now come here, you can actually see trends of daily changes. If you want to look at new cases, as you can see, this is for Nigeria. As you can see, it was going, let me say Nigeria has been extraordinary, especially the Nigerian Center for Disease Control, in providing access to data. So Nigeria has one of the richest COVID-19 data for Africa. So a lot of things can be done with data from Nigeria. So you can actually see the trend already. So when people are saying there is a difference between you reporting that there is a second wave of COVID-19, that COVID-19 is increasing. Many journalists will just go to press conference where some experts would make such claims, and they're just going to run the story like that. But where is the evidence that there is a second wave? But if you look at what I'm showing you now, this graph is showing you the daily changes in the number of cases of Nigeria. Look at when the plateau here was averaging, like the number of new cases was 603. That is in mid-July. But if you now look at January, the latest figure, we are now seeing an average of 1,525. So this picture alone, you know, the number of ideas that you can have like this is giving you an indication. For instance, now you can say that within the number of, let's say, in 7-day average was 602. We can say it has more than doubled, it nearly doubled. Good night. So you can say it has nearly doubled over a period of 5 or 6 months. So that is something from this nutshell that you can see in the number of cases. Then Google also has deaths too. You can change it and just check out the trend in deaths too. There has been a report that the death rate is climbing. We attend press conferences, but you don't have independently verifiable data on your own to tell you whether this is the case. But I'm telling you that ordinary Google on its own, without you doing any complex things, would actually present to you the number of deaths that you are actually seeing. So as you can see from every day, you can see on June 16, Nigeria recorded 31 deaths. The next day, June 18, 6 deaths. And this data is continuous. So how many deaths on yesterday? Nigeria recorded 14 deaths. So we now having a 7-day average of 13 deaths per day. So this is actually something that is available, and it's not just Nigeria. So if, because I'm in Nigeria, that is why it's used the geotagging. But if I want to say, let me look at a country like Mexico. So just type COVID-19 Mexico. Because I'm in Nigeria, that's why it's bringing. But look at it, same rule applies here. Same way we are getting the data without, from google.com its own, without even looking at any other source. So you can see the number of deaths. Mexico has 1.69 million deaths, million cases of COVID. The number of deaths is 144,000. And you can also see the trend too, in the same way that I've already described it for Nigeria. And this data is available for individual country. And it's the way uh, you can, if you're not sure about something, I will also recommend is because I say you should always endeavor you are verifying is this, because yeah, Google is a large multi-billion-dollar company, and but they also provide you from information about where the data is coming from. So you can actually click about this data so that you can be able to properly attribute it. So you can, so it is going to help you with information about where the data is coming from. Now back to my slides now. I think like I said, that data is everywhere. Data is everywhere, and from Google alone, you can actually see that we are getting. I hope my slides are still being shared, but if it's not, let me just. I'll continue with the hope that you are seeing my slide. So we said data, I said data is everywhere, and I've demonstrated with Google. Then another thing is this, there are some stuff that you may not be able to get via Google. We have really localized insights. And because I'm in Nigeria, I would like to use the example of the Nigerian Center for Disease Control. So they have a dedicated COVID platform. And this is Nigeria's COVID-19 dedicated platform. And this actually shows the trend from one state to another. By default, they arrange it in the order of the cases per individual state. Lagos, which is Nigeria's commercial capital city, has the highest case, followed by the federal capital. And my state, which I'm currently in, is Oyo State, which means my state has the 5th highest confirmed cases of COVID-19 in Nigeria, which is around 4,800. There is a lot you can do here. Some people will say that there are different approaches that you can play around with regarding this particular type of data. For instance, there was a time I was doing something, I was asking myself, a data set like this, and I think this also exists from one country to another. Your local disease center should be able to provide this kind of data for you on their own website too. So there was a time I was asking myself that out of it, if what's only pops out is you can see the places, the country, the state where the highest number of deaths are reported. But this is still not newsy enough. This is still not intuitive enough. So I asked myself a question where I did something some time ago, and I was asking myself, where do you have a better chance of surviving COVID-19 in Nigeria? So these are the ways that I think, by using these examples, I hope I'll be able to inspire you to look at and reimagine how you think about data. So I asked myself, where do you have a better chance of surviving it? And if you want to take the newsy and sensational angle, you can ask yourself, where do you have the more chance of dying of COVID-19 in Nigeria? So that particular metric will not be provided by this, but you need to actually calculate something, which is the number of deaths versus over the number of confirmed cases. In other words, in which case, in which states are more people that are testing positive dying of COVID-19? So that is where you, and is a factor of case fatality ratio. There is a national, there is a global case fatality ratio, there is a national case fatality ratio, and you can also calculate state fatality ratio. And there are some countries that their data is so good that they actually put it on the level of individual streets. You can see those kind of data in those kind of countries. So that is one way that you can use the data. But there was a time I interviewed Nigeria's Center for Disease Control, their chief epidemiologist, and I was asking for a particular data on individual tests that have been conducted. And we were able to, so it now brought my attention to where they have their publications on this platform. And like I said, I'm not sure every country has this level of detail. So they always have these updates that is published every week. I'm downloading it so I can actually see it. We can actually see it together. So they also have a section on the number of tests. So you can also do, there are people that have been, you would have done stories like your country has done 1 million tests have been conducted in Mexico. But which states, which parts of Mexico are most tests being conducted? Which parts of the city, of the country are underperforming as far as testing is concerned? So that is something that I was able to get. This is something that is also worthy, because when people are not getting tested, you will not be able to do very good stories. So you can talk about regions. There is a lot of stories to do about regions where few tests are being conducted. And if you remember in my earlier statement, I said data alone will not tell you a complete story. It has to be supported by so and so. For instance, if I find out that my state is lagging behind in testing, I will not stop there. Then I can now approach my local officials. Are you encountering any problem regarding testing? You'll be surprised what they are going to tell you. They can tell you that maybe a machine is no longer working. Then that is your story. And not just you saying that Nigeria has conducted 1 million tests. So what is written, what is responsible for those parts of the state or those parts of the country where most tests have been conducted? So you have to always see yourself beyond this. So I put Twitter in my slide because there was something, this report that you are looking at, they always release it every week. But there was something I did some time ago. I was trying to track, uh, I was interested in knowing the status of the pandemic in my state every day. I wanted to know whether it is on the rise. I wanted to know whether and I wanted to develop a widget for local blogs that they can also use to track the pandemic. So this is the graph that I was trying to show you. I was trying to understand the daily confirmed COVID-19 cases in Oyo State in 2021. So from January 1, so Nigerian Center for Disease Control, they have a very active Twitter account. So every night, since the pandemic began, every night they will tell you the number of cases that were confirmed on that day. And there was nobody that was tracking it for your state, for my state. I'm talking about a trend that was publishing a specific figure for it. So I'm trying to get to you to, okay, now this is the chart. Every day this comes out. Every day they put it out like this. And as you can see, yesterday, Oyo State had 68 new cases. So, and why is this important? So I will just go now to the back end of where I designed this from, and I'm now going to add that so that you can actually see a trend, or you can actually see an overview of what is responsible. Are cases increasing? As you can see, from ordinary 4 cases on January 1 to over 120 cases in January 13. You can see the progression, and you are able to actually provide an overview like this. When you write stories and you tell people in your publication 20 new cases, you tell people 1 million new cases, and you don't put it in visual ways like this, it becomes extremely difficult to convince people that this is a particular serious case to do. And I did not stop here, because just one graph alone may not tell an entire story. So I wrote something on whether, so there was a debate in the States about whether schools are now safe to reopen. And I think the story was published on January 13th. So unfortunately, if you look at January 13th, that story was published, it was the day that the state recorded the highest number of cases since 2021. So that was really, really important. And I'm just trying to show you that data really allows you to present with, you are not throwing yourself in the middle of the story, but you are actually providing a general picture that would allow people to make their own independent choices. I did not manufacture the data. The data was provided by by the government itself, and they are able to actually see whether there is a trend. Then, and not beyond that, you can also talk about active cases. These data are available. You just have to just input them and provide analytics. So we simply use that my state has the fourth highest active cases too. Although if you compare it to the rest of the world, you are also able to understand that the comparison may not be as severe as what you have in your country. But this is what we have in Nigeria. So back to my slide. So you should also be able to have a similar arrangement if those kind of data is available where you are. They are really going to help you a lot in writing very good and informative stories. So as we can see, these are some additional sources that I would always recommend. The WHO itself has its own data bank, which is the covid19.who.int. Is very, very interactive and exciting. Maybe I should actually show you so that you understand. I think I opened it before. Okay, yes, this is the tab. As you can see, this is the interface that it has of the WHO's COVID-19 dashboard. And as you can see, it's real time. If you want a global, if you want it on a daily basis, if you want it on a weekly basis, you can always have a good understanding. That was the time I was tracking this so that I could be abreast of the trend, because initially Africa had the lowest number of confirmed cases, but it now has the second highest. So this is something that you can take a look at too. And I know playing with data, creating infographics may be difficult for many people, but it's not something that I think is too hard, or at least to give your story some live, and to ensure that people are able to interact better, or for you to even get an idea of what you are doing for. Now, for instance, now look at this. If you look at this graph, if you look at this ordinary data alone that you are looking at, you can actually be able to, in a nutshell, you can compare the pandemic status in your continent, in your region, with the rest. For instance, now we can still say that over 1 year later, depending on which angle you want to look at the Europe. Is Europe fast catching up with America? Then not just that, then you can, total number of cases, you can also look at the trends. The graphs are there. These are all verified, independent, these are all WHO data. And I don't think there is any bigger authoritative mouthpiece regarding this epidemic other than the WHO. You can look at it. These graphs are really, really important. They can show you where the pandemic is rising, where is achieving table. As you can see here in Africa, this is the graph. It is also peaking. So it is. For instance, in some countries, you can see maybe they are reducing, while in some areas they can be increasing. So these are insights that you can get by just looking at the data. But like I said, once you've gotten this data, you now ask yourself, attempt to explain what is responsible for this. How can we maximize? How can we explain what we have? What are we doing? What is our country or what is my state doing regarding this particular pandemic? There's also a good platform that I've been using to get a nutshell of the pandemic. It is called NCOV. It is NCOV NCOV 29 2019.live. So it's synchronizing every data from across the world on a single platform. You can get tests, number of tests, you can get data on number of hospitalization, number of recoveries, number of admissions, severe cases, all in one interface. And I recommend that you should also check it out. It's a very, as you can see, it's rich. It contains data from every country of the world. So it is rich, it is informative. You can, something I love playing around it is this. If you want to know cases per million, for instance, while America has like the biggest case in Africa too, we have countries like in Africa, we have countries like South Africa that has the highest case. But a very important index is the cases per million. For instance, how many people out of 1 million in each country that metric is able to put all the countries of the world on the same pedestal. So you're able to see this. You can also export it. You can do your own analytics based on this. Is insightful. And for instance, one of the things I love doing is if I'm playing with from data on this, there is a website that I'm involved with. It is called Health News Nigeria. So I was able to design an infographic that is active, that you can actually have a trend, have a picture of what is happening in many African countries. So when you have that, when you have central data sources like this, you can have. So when you have, so yes, I also have that particular kind of data also allowed me to do infographics like this, like the number of COVID-19 tests carried out by states. Nigeria has 36 states. So as you can see, wherever you are, you will be interested in information like Nigeria has carried out 2 million COVID-19 tests. But for Nigerians, you will understand that it's not everywhere that these tests are not equally or evenly distributed. The states that are doing most of the testing, Lagos is doing most of the testing, followed by Abuja, which is the federal capital. Then the third state is called Port Harcourt. So these are the three states that are doing most of the tests. But to the global world, to the global audience, Nigeria has tested over 1 million people for COVID. But as you can see, as shown in this map, there are some that this map is color coded. There are some that are not doing enough testing. So as journalists, you can talk about somebody, if you're in a place like that has tested like just 6,000 people out of his millions. If you're if you're a Nigerian journalist, you can start exploring issues like this. You can start asking questions that why is it that this state is testing fewer than these people or than other states? And is the COVID-19 data from this state a true reflection of the pandemic status in the state? So these are the issues that I think we should be giving much attention to. And so going forward, I believe that as journalists, we should always endeavor to go beyond the obvious. do not just we should lose interest in screaming headlines like 1,000 cases confirmed, but we should let data take us to more intuitive headlines, like a case of a state that has only tested 1,000 people. What is responsible for the state for that particular scenario? I know sometimes it takes a lot of hard work, but that is the essence of journalism. That is the essence of this profession. And that is at which point we can let data to start making a lot of difference and significant impact on whatever we are trying to do. So I endeavor to go beyond the obvious. Every day our government releases a report of the number of cases that they've confirmed on that particular day. It is our job to go beyond what they are giving us, to now break it down and look at what should actually be given attention. So let's go beyond screaming headlines and let data take us to more intuitive ones. So like I said, you have to get your own tools. Sometimes you have to do it yourself, like the case and a good tool that we use if you want to play with data. Spreadsheets are always important. So spreadsheets are important for you to export and analyze your data. So, and I'm trying to, so when you have, normally the spreadsheets are software that you can use, but I've found that I've come to realize that I carry out most of my data analysis on Google spreadsheets. And because everything allows me to work on an individual template. So what I'm trying to do is that I'm trying to demonstrate how you can do it. So this is what spreadsheet looks like. This is what spreadsheet looks like. So when you are creating a new spreadsheet, it appears like this. Now, when you now want to now bring in data, when you want to bring in data and you want to start analyzing it, and you don't want to just say that Nigeria or your country has this new number of cases. So you go to the raw data source, like I'm going to Nigeria's COVID-19 platform that breaks down the data state upon state. Then they take everything. Let's say I'm taking everything up to the last state, which is Kogi State. So you bring it back here, you just copy, then you paste here. Now, remember I mentioned that I wanted to know in which state you are most likely to die of COVID-19 in Nigeria. So the metric I'm going to use for that is what we call, I'll just compute the case fatality rate. So I'm going to insert a new column, case fatality rate. So what is case fatality rate? Is the number of deaths, in this case, which is E, that is the number of deaths, E2, divided by the total number of confirmed cases, which is B2. You now multiply it by 100. As you can see, automatically it computes for, you can just, once I drag it down, the metric, the figures for others will just come in. But this is not everything. We've not gotten to where we are going to yet. So I can just reduce it to one decimal place. Now I can now sort it to get the countries, the cities where you are most likely to die of COVID-19 in Nigeria. To this, for instance, look at a state like Kogi State. The CFR is 40%. It simply means that in this state, 4 out of 10 patients that test positive of COVID-19 will die. Now I can stop at that level and be like, okay, that's my story. This is abnormally high. So what do you do? But then you look at it again. The state only has 5 positive cases. How possible is it that it only has 5 positive cases, out of which 42 people died? The other thing is this. There's the second one has the closest one is also like 7%. So that is the second highest. So if I want to now do a particular story, so my top 10 stories, 10 states where you are most likely to die of COVID-19 in Nigeria would be this. You just drag it up to this level. Then that is the story, but you have to make some explanations. For instance, now as a journalist, I'll be curious to know what is happening here. And that could actually lead me to a wide number of exclusive stories. And talking of infographics, you can also insert, you can simply actually generate a graph here. As you can see, as I just quickly generated it, it's something that you can actually use in my story already. And I know it may look as if I'm too fast, but I'm just trying to tell you and expose you to the possibilities to what you can do with data. So, and a good example is a spreadsheet that I just showed you. So you have to do many things yourself these days, because I think as a journalist, you are the one that you know what you are looking for. I know in some studio, in some newsrooms, we have a data section, but I'm a freelancer, so I'm used to doing all of these things on my own. So, but there is an issue now. When there is no data, what do you do? For instance, let me quickly give you a quick background. There are two countries in Africa, Tanzania and Madagascar. They've not been submitting data to WHO for their COVID-19 data. So now, so what do you do? So to provide evidence that, so we go to Google. Let me show you evidence to support that. So you will not know, you will not think I'm making this up. So Madagascar COVID-19. So when you look at it, you will see that there is, you may say that there is data, but in the true sense, just look at the section at this. Okay, the information that is moving, just be looking at the new cases section. You see that, okay, new cases stopped on around October. The last time they recorded new cases was in October 13. Since then, no new case has been reported. So what I'm just trying to say is that there are cases like this, countries like this, during which there is no data for us to share, that they are not sharing new data. Is it that now there are two ways to it? Remember, I said you should always approach it with an open mind. Never assume. Because on one hand, we can say that maybe the COVID-19 pandemic is over in that particular country, but you should also be able to look at it from another angle. And this is the reason why it's always good for us to have effective dialogue with experts on the field, because we are not the scientists, we are not the ones that are producing this data. So one of the things that you can do is sometimes for you to use data from elsewhere, from other things that have absolutely nothing to do with COVID-19 at all, to infer what could be the true state of the pandemic. What am I trying to say? Okay, there is a particular tool that Google has. It is called the Google Mobility Report. Remember when the COVID-19 pandemic started and the movements were restricted from people from one part of the world to another, you can still be able to get data that can help us to infer whether there has been some movement, whether there is a particular lifestyle that could be predisposing people to getting infected with COVID-19. So what Google did was to now, they were able to track or pull together data. They're able to pull data together that shows where people are going to, where people are visiting more in countries of the world. And how were they able to do it? Don't forget, everybody is always walking around with phones, and these phones are always tracking our movement, even though they send anonymized data, locations, so they have a way to protect the privacy. But that information is available here, and you can actually search for countries from one country to another. I don't know why my system is hanging. And okay, region. Now, what I was able to do in this particular with this particular platform is I was able to actually know which place in these countries that their governments are not releasing data. I was able to know which places are the people visiting more. You're able to know where, and when more people are moving towards this place, okay, yes, this is very good. Very good. This is what I'm looking for. Tanzania is one of those countries that are not releasing data. But I still say that you can still do some data story, although it may not be able to be on COVID-19 cases. So you can still talk about since the pandemic began. As you can see, the number of people that are visiting retail outlets in Dar es Salaam. Dar es Salaam is a capital city, has reduced by 10%. Visitation to supermarkets has reduced by 32%. Then workplaces too, 22%. Fewer places are going to work. Even though, now what can we infer here? That even though the country is saying that its COVID-19 pandemic is over, we can still see that fewer movement, people are moving, people are visiting public places, few, not as you would have expected in large quantity for a country that says the pandemic is not over. So this data is something that people can expand to really generate and write stories around that shows you the lifestyle that people are getting used to and adjusting to COVID-19. As you can see, it's something that is quite recent, January 17th. So I think that is something that I also want to talk about here. Other data can allow us to infer what we do. For instance, even though there is no data on Madagascar or Tanzania, there are central data regarding vaccination coverage that can help us to infer vaccine coverage and how prepared the country would be for COVID-19 vaccine. Stories can still be done. WHO has that kind of data. UNICEF has data on vaccine and immunization coverage regarding these countries too. So, like I said, you should always embrace and approach data journalism from the angle of the data talking to you, not you telling the data what you want. Is the one that is going to review what you have to do. So the second aspect is this that I think is also important. Let's say you've gotten your data and an expert. One thing that I think COVID-19 has brought about is that there is a need for journalists to be able to challenge claims made by anybody so that we can be able to have truth and not continue to propagate fake news. What am I trying to say? There are cases of like Madagascar in which the country said it has the cure for COVID-19. Unfortunately, many journalists too reported it that Madagascar now has a cure for COVID-19. Even though we are not scientists, not everybody can be scientists, but there are some basic rules that are important for you to know when it comes to this. And I would like to tell you that this is not something that is peculiar to COVID-19. In Nigeria, we've had cases where somebody will say that he now has a cure for HIV. And we've seen this coming out over and over again, in which somebody will just call a press conference, invite journalists, provide information, and the next day that claim is all over the news without any more challenge. I think it has gotten to the fact that we need to, you as a journalist, because somebody is wearing a lab coat and is telling you confidently that this claim is true, doesn't mean that we should take it look, line, and sinker. There are some basic things that you should know. For instance, what is the definition of cure? And who declares that something is a cure? It is not an individual that is going to declare that this substance is a cure. It is the regulatory agency In the US, that is the US FDA. And they always, and there is a line, there is a process that is involved before a substance to go from being a drug candidate to a cure. So it's not the researcher that is going to call a press conference and start saying that I have a cure, and you as a journalist, you will now take notes too. In the next morning, you are typing it, this so and so person now has a cure. Have you proven it? Our job is not to go into the lab and start testing substances out. Our job is to ask the right questions. Our job is to ensure that we uphold the tenets of science, the basics of common sense, and so that nobody will be able to make any claims, invite us, and be expecting that whatever he or she has said is making it to the newspaper. So you as a person, you should know the basic rules of science, know what clinical trials are, what happens. For instance, if I want to claim that let me see if I have a sachet. If I want to tell you that this drug that I have in my hand will cure you of COVID-19, you should know how this is expected to go. The questions now you start asking is that, have you done clinical trial? What are the reports? What are the findings of, where did you do your clinical trial? How many people did you recruit for the clinical trial? Where was the clinical trial conducted? What were the findings of the clinical trial? What went wrong during the clinical trial? Was it safe? How did you determine that this is effective? What is the efficiency? How many people that got the drug eventually had a disease? How many people have been totally cured? So these are the ways that anybody can make a claim today. But these are the boxes that such claims must check. And this is really, really important. For instance, today, earlier today at a WHO press conference, I think it was Africa CDC press conference, that we were made to realize that even though we've had lots of claims about herbal products, in many individuals claiming that they have herbal products that can cure COVID, that none of these has been presented for clinical trials. None of them has been presented for valid clinical trials endorsed and supervised by independent international health organizations, regional health organizations on the continent. But unfortunately, our newspapers are awash with publications of these particular claims. So if somebody is telling you, I'm not saying that you have to understand and be arguing over the principle, the mechanism of action of that particular substance. No. But basic questions that you need to ask is that, how did you come up with this product? Where has it been tested? Where is the independent report of the scientific, of the testing, clinical trial in which this substance has been tested? And what are the regulatory agencies saying? Most of these claims do not go to the regulatory agencies. So you ask, why are you not approaching the regulatory agency? So that is your story. The person may come to you with reports of you, I want to get this story, I want to get this story into your news outlet, but it ends up about you telling us what this person is thinking for avoiding the due process. That's a story on its own. And I think these stories deserve to be told. And we as journalists should be on top of the situation and not just choose to ignore or accept whatever people present to us with. So you need to research the expert too. If somebody says he has a cure for HIV, you have to ask yourself, what have you done on HIV before? And there are several tools to do that today. One of them is called Google Scholar. Let me show you. When you go to scholar.google.com, it's like a research section of Google search results. So my name is Paul Adepoju. So I'm a scientist. So I have a science background. I practice, I conduct research. So if I search for Paul, this is my name, Paul Adepoju. As you can see, user profiles for Paul Adepoju, you can see this is the one that is me. So once you search for that person's name that is making those claims, you will see the publications that that person's name has been connected with. As you can see, this is my name. This is a story I did for Lancet in 2019. This one is for Lancet HIV in 2020. This one is for Nature in 2020. So this is how you research individuals. Then from this, you can actually see the institutional affiliation. that the person has said, how many people have cited them. But when you search for that person's name and there is no results, no search results, nobody has cited him, the person has not published anything in that area before, then you can now you can begin to have doubts regarding the validity of that person's claim. So that's something that I always recommend. Search the expert, research the expert. It's not just Google Scholar that exists. There is also another tool that is called ResearchGate. It is also serving a similar purpose. So please and please always endeavor that you are able to do, you may not be able to do everything, but always endeavor to do your best so that you are not talking about medicine. You are not asking a carpenter about medicine. You are not talking about surgery to a tailor. A car mechanic is not telling you about how to do neurosurgery. So these checks are always, always important. And thanks to the internet, they become much more easier to do. So ask the basic questions. And you don't have to be bombarded, you don't have to be overwhelmed with the big languages, with the big scientific words. You just ask basic questions about these claims. How does it work? How did you develop this? What is the research community saying about your finding? Why is yours not in a scientific journal? Which journal has published your finding? So these are the ways that I think we can go a long way to confirm this. So another thing I always do is that you confirm from other sources too. Sometimes when I read stories about a particular claim, even when you are in doubt and you want to pick up a story, the story looks tempting, it looks exciting, it looks promising. Another approach you can do is to talk about asking other researchers in that field about their opinion about what you are reading, about what you are trying to report on. Does this make sense? But now you are presenting that findings to another expert in the field, a reputable expert in the field, and you are asking for their opinion on that particular issue. That way, you enrich the quality of your work. It's no longer an instructional approach. It's no longer the person telling you, this is what I want you to believe. This is what I want you to take home. This is what I want you to tell your audience. But you are here on top of the situation. You have the person's claim and you have other experts' claim. You now merge it with whatever additional information you can have, then it becomes much more valid and much more reliable for you to present to the audience. So also virtual press conferences have made it much easier to access experts. Like today now, I've been able to I've asked the DG of the Africa CDC questions. I've talked to the WHO regional head for Africa because virtual press conferences are being held now. And that is much easier now to attend than before. So endeavor to participate in these forums, and because it brings you much closer to the experts and the authoritative persons that can allow you to verify whatever claims you are having in any part of the world. So as I conclude, I want everybody to understand that health journalism is now mainstream. And we as health journalists, we should endeavor that we are not caught in the web of fake news. We understand how fake news became popular and journalism began to lose, many people lost trust in journalism because of this fake news generation. So it is now in our hands. In the past, health sections was usually restricted to the back of the newspaper. You have to flip, and flip again before you get to the health section. But now it is it is now occupying front pages because of the relevance of the profession at this particular point in time. So to ensure that we are no longer sent to the back, always ensure that you get the right data, always ensure that you are able to verify the data, and always ensure that anybody you are talking to that is making any claims, you are able to ask the right questions so that you don't misinform the audience. So thank you very much, and I hope, thank you very much for this opportunity.
Thank you so much, Paul. This was an excellent presentation. So we've gone over, but we have a couple of audience questions. And I think some of these questions would be really good for you to answer because they're actually like very important issues. So one of the first questions comes from a participant named Ali. He writes, a lot of information and expert claims about alternative medicine for coronavirus symptoms are circulating on social media. And also our audience of live health shows request to invite experts of alternative medicine in these shows, and very often they suggest traditional medicines for relief of coronavirus symptoms. How should a journalist deal with these claims, or even start to verify these claims, like from health institutions such as the WHO, like if these claims aren't available, like on the WHO website? And I think that like refers to like traditional medicine, plants, and things of the kind. How would you deal with these claims and, you know, local health shows kind of putting up these experts who are traditional herbalists?
Yes, I understand, because for every disease that there is no cure, it creates a market for anybody that has something to jump on and present something. So you, as a journalist, with this particular kind of claim, you talk to the scientists. You have to talk to the scientists. You have to talk to the experts. You have to ask questions about this. Then those questions that I ask, you have to invite the person that is making the claim, that, oh, yeah, what is this thing used for? How did you know that it works for that thing? Who has independently verified it that it is effective? What is a regulatory authority in your country doing? Because it's not everybody that can, it's not every substance, it's not everywhere that anybody can sell any substance to anybody for a particular store. So have you obtained the authorization or the approval of the drug agency in your country to market this to people? So these are the questions that I'm going to ask, and I'll let it reflect in my story.
Excellent. There's another question here from another Nigerian reporter named Sunday Elom from Nigeria. And this person asks, in terms of getting verified official data, now you showed us, for example, COVID-19 cases, testing, vaccination data, but this person asks about particularly documents on health facility projects by the government ministries or agencies. And this person says it's actually very difficult to get any documents on health facility projects that the government has going on across the country because they always claim they're not permitted to disclose that information. How should a journalist navigate getting that information so the story doesn't end with efforts made to get this information were not successful?
Yeah, that's a very, very good question. And I would admit there is inequality in access to data. There are some there are some stuff that the data records are impressive, and some that they are not impressive. So in cases like this, you have to do the hard work, depending on how important that aspect is to your story. You have to put your foot on the ground. You have to get out there and talk to people. Then, personally, I'm always not a big fan of you saying like 2 hospitals here are working. And so what? 2 hospitals. So there are more relevant aspects for you to define that story. Find other contexts. If a data is not available, if a data set is not available, work with what you have, or go the last mile and actually get there yourself and find out what you can do. I hope it's not perfect. It's not a perfect terrain. You just have to make do with what you have, and whatever you can't have, try and get on your own.
Yeah, and here's a story from Patrick, who's on our team. And he asks, with all the attention paid to the COVID-19 pandemic, do you think the media have been ignoring other important health stories? And what stories besides COVID should journalists be covering?
Yes, that's a good question. I think a lot of things are happening in real time regarding health in general, but I see a lot of overlap from COVID, and that's something I'm intentionally doing with my stories. When you look at, for instance, when you look at gender issues, when you look at access to maternal health, when you look at family planning, when you look at even malaria, something that I'm really looking forward to understanding is how COVID has actually impacted malaria, because the symptoms look alike a lot, and many people are not going for treatment there. So you still have to weight on these things. But a good way for you to keep track of all of these things are the global reports. For instance, every year for HIV, there is a global UNAIDS release a global report for HIV. There is a global malaria report. There are reports on all of these conditions that you have to track intentionally on your own to seek them out, or you do the field work. I remember a meeting I had with the editor of Nature on one of my last trips to the UK. We had a coffee, and the major advice he gave me, which I would like to give to every journalist, is always take meetings. Don't just go to scientists or people on the field because you are looking for stories. You can just meet them. How's work? What is happening? I've unveiled, I've revealed many, I've been able to identify many story leads by just talking to people on the field, people that are involved in the care. They are going to tell you what the trend is. Then you as a journalist, you are now going to go the extra length of doing thorough research and finding out additional details that your story would need.
Thank you. And here's a question from, I apologize if I mispronounce your name, Chibuike. And this person asks, how do you deal with verifying claims, data, and facts when you are time constrained? And that can definitely be an issue when you're on daily news deadlines every single day and you're not a health expert. I think you showed us some really great resources on Google. Is there any advice you'd have for the daily news journalist who's on deadline?
Yes, I think it's something that it can be done with practice, with when you are used to those things. As you can see, look at it, didn't take me up to 3 seconds to get the latest information. Then you also have to be prepared. You also have to be prepared. Keeping tracks of many data sets at the same time. I already have tools that I'm using. Then, there are some things that work for daily outcome, for daily reporting, and there are some that you have to set aside for special reports. So you just have to try your best, and over time, things will become much more easier for you. That's the best I can answer for now.
Brilliant. And here's a question from Lillian. She asks, how do we tell the stories of the people who are part of the data? For example, a lot of data, for example, is anonymized. Like we know how many cases there are of deaths or people who have caught COVID-19 or of other data of like, testing, but like, how do we actually find the people? I suppose Lillian is asking.
Yeah, that's a very good question. And finding the people for journalists, being able to put face to the story is actually one of the best things you can ever do. One of the best stories that I've written for during this COVID pandemic, I think was by Devex, in which I wrote about healthcare workers on the front line. Like I said, the story does not start and end with you getting the data. It's something that is actually beginning. The data will only tell you where to start looking at. So, like I said, when you see professionals, when you see experts on the field that are directly involved, then it becomes much more easier for this is the story I'm talking about on the
Mhm.
front line of Nigeria's coronavirus. Health workers brace for the inevitable. So I've already seen this story was the data aspect was provided by I attended a press conference by WHO in which they were talking about the ratio, the proportions of health workers that were affected. So I got that. Then I now went to the field. I went to a major hospital in Nigeria. I spoke to a doctor that tested positive for COVID-19. His experience during quarantine. So this was the element of the story, and that is how you do it. You get the data first, then you can now talk directly to people that are directly involved in this particular situation, so that they can tell you the human angle of the story. Combining human angle to data is always a winning combination for a good story.
Mhm. And here's a question from Cyrus out in Haiti. In the situation of a new outbreak like COVID-19, when it initially happened, scientists didn't even know what it was or how it worked at the very beginning, which permits rumors and fake news to spread. How do you deal with the situation in a country like Africa or in the Caribbean, where the number of people infected appears to be low? But I suppose he also means that could be the result of just the government not having data and you have rumors spreading about the virus?
Yes, that's a good question. And one thing I also like to do is please and please take your focus off the total number of cases, because whatever you do, it will never be accurate, because you will never know the absolute figures. What I would rather like you to do is indices like total number of testings. Now, what am I trying to say? If look at this data you have on your screen now, Nigeria has conducted 1.2 million tests. Now, out of these people that have been tested, how many tested positive? This, for me, is a more important metric to show us, to provide a clearer picture of the pandemic. So I will never agree that Nigeria only has 114,000 cases. No, but we do not know the accurate figure. No country has the accurate absolute figure because nobody has tested everybody. So, but what we can firmly affirm is that out of the people that have tested, 10% of people that have tested are positive, which means 1 in 10 people tested for COVID in Nigeria is positive. That is a more reliable metric, and that is the approach that I think I would encourage anybody to take.
Excellent. Thank you so much, Paul. And our participants asked, may we share your slides on the forum group so they can take a look at it and have access to the resources?
Yeah, no problem. I will mail it to you and
most excellent. And I did share on the Zoom chat that you can follow Paul on Twitter, and you're going to be able to see him there if you'd like to look at his work. And now for some remarks just to wrap up. Thank you so much, Paul, for doing this training. It was absolutely excellent. I certainly didn't know about Google's mobility report or the NCOV 2019.live, so that's really, really cool. And thank you for sharing your expertise with this forum. And if you haven't checked it out yet, there's a wonderful profile of Paul on IJNet. He was a journalist of the month for our forum group, and it really gives an excellent profile of his work. Next week, IJNet's managing editor, Taylor Mulcahy, will be hosting Luba Kasova, an audience strategy expert and researcher, and author of The Missing Perspectives of Women in News, to discuss why women are missing from news coverage and what you can do about it as a reporter. Thank you again, Paul. It was a pleasure having you train our forum members today. And thank you to everyone who joined us. Please stay safe, and you can see a copy of this webinar on ICFJ's YouTube channel. We'll have it up in the next 24 hours. Thank you, and we'll talk again soon.
Bye.
Bye.